Good morning everyone. It's 7th of December 2025, Sunday, 9:50 a.m. here. I'm Dr. Priyanka Chaudhary, an ophthalmologist. In this video, I'll be talking about visual acuity, its definition, then what is visual angle, and how this angle is measured in radians, arc minutes, arc seconds, degree for visual acuity purpose. The charts usually test at arc minutes and arc second level. Then visual acuity testing types, like different types of the visual acuity. That's minimum legible or minimum resolvable threshold, minimum visible threshold MVT, then minimum separable threshold MST or minimum discernible threshold. A subtype of it is Verniers acuity, that is also known as hyperacuity, and why it is called so we'll see. Then the factors which affect the visual acuity, which are optical factors, physiological factors, and the target and background factors in the visual field. So these points we'll discuss little bit in detail. So what is visual acuity? First we'll start with the definition of visual acuity. What is visual acuity? Actually, it's a measure of clarity of a vision or form, how well a person can see an object, target object or focused object. According to international standards, visual acuity is a numerical variable that characterizes the ability of visual system to recognize optotypes. Optotype is what? Optotype is any object, size, symbol, letter which has certain symmetry, certain size, certain design, a specific size design that is used in visual acuity testing charts. It's standardized and it is used to assess or evaluate or test patient's visual function or any individual's visual function, any person's visual function, and it relates to ability of visual system to resolve the details on a focused object. And it can also be defined as a person's ability to detect two objects as two distinct objects, to discern two objects as two objects separated by minimal distance. It can also be defined as a measure of forms, that is reciprocal of minimal angle of resolution, minimal resolvable angle. What is that? We'll see. And this minimal resolvable angle for human eye, it is around 1 arc minute, and it is limited by this diffraction. The various things are there. One of the limiting factors is cone dimension and cone spacing, as the minimum distance between the cones is around 30 seconds. That is measured 30 seconds. It is the angle that the cone spacing it makes with the nodal point. So this spacing, it decides the minimal resolvable angle for the human eye, and it's around 1 arc minute, because at least there should be one cone that needs to be unstimulated, to see two objects as two distinct objects, to recognize a form of an object, for minimum resolvable. What is resolvable and what is minimum visible, we'll see. So that was about visual acuity, and visual acuity depends. There are so many factors which affect visual acuity that we'll see later on. But first we'll talk about this. And one more thing, visual acuity, it depends upon minimal angle of resolution, and it is, if the minimal angle of resolution is small, then visual acuity is better, and resolving power is inversely proportional to the minimal angle of resolution. If the minimal angle of resolution is small, then resolving power is more, and visual acuity in turn directly proportional to this resolving power. More the resolving power, better the visual acuity, and less the minimum angle of resolution, better the visual acuity. So that was all about visual acuity definition. Now let's move to nodal angle or visual angle. What is visual angle and what is nodal point? I have already discussed. If you want to know what is nodal point, I have already discussed in one of my videos recently posted. but I'll share the link of that video in the description box. You can see that thing, and I have done little bit correction in the comment section. What is nodal point? Nodal point, it is the point in a thick lens system. There are two nodal points actually, but for convenience purpose, to simplify the mathematical calculations, even average of two nodal points is taken in human eye. For human eye with a power 60 diopters, it is taken to be just behind the posterior lens surface, around the lens and near the lens, and it is around 5.5 millimeter behind the corneal vortex. It is the point with the maximum or the steepest corneal curvature with the maximum power, and 70 millimeter from the retina. So that's the nodal point in the human eye. For as per the reduced schematic eye with eye refractive power as 60 diopter. So that's the nodal point, and nodal point, it is equivalent to optical center in case of a thin lens. Optical center in case of a thin lens, it is that point where there is no deviation when the light is incident at the optical center. When it passes to the optical center, there is no angular deviation, there is no linear deviation or linear displacement occurs at the optical center in thin lens system. And in thick lens system, this optical center term is replaced with nodal points. There are two nodal points. It gets split into 2 points, and that is the these are the nodal points. So what happens in thick lens system, when a ray is incident at the nodal point, what it does, it gets shifted like this. There is a lateral shift to the other nodal point, and there is ray of emergence from the nodal point, another nodal point. So this incident ray at the nodal point, the angle of incident ray at the nodal point with the optical axis, and the angle of emergence at the nodal point, second nodal point, with respect to optical axis, these two angles are similar. So there is no angular deviation, but there is a lateral shift or linear displacement in case of a thick lens, and that's the nodal point. So that's the concept of the nodal point with the diagrams. Nicely, you can see the video I have shared in the description box. Video link I have shared in the description box to see the significance of the nodal point, what it is with the diagram. So if it is a thick lens, suppose this is thick lens, a ray of light is incident, there is some refraction here, it undergoes some refraction, it hits the nodal point here like this. This is the ray of light, it undergoes some refraction, hits the nodal point here, and then the ray travels like this, hits another nodal point here, then ray emerges like this. So this ray of incident here inside the lens at the nodal point with the optical axis, this angle is equal to this angle that is made by the emergent ray at the nodal point, or the ray that is emerging from the nodal point, second nodal point. That angle, these two angles are same, and that's why when the light ray hits at the nodal point, first nodal point, and when it gets shifted to the second nodal point, and then it emerges, and these two angles are same with respect to the optical axis, and that's why there is no angular deviation at the nodal point. With diagram I have explained. Now what is visual angle? Now visual angle, it is an angle made by an object in the visual field with the nodal point of the eye. So it is measured from the side of the object. There are two sides. There is object side and there is image side. Object side means this is the visual field, that is the object side for us, and image side is the retinal side for us. So when there is an object here, suppose this is the object, it has width, it has height. So this is height. This height, whatever these edges, vertical edges, what angle they make at the nodal point of an eye, that is the visual angle. So yeah, how it is measured? It's measured, it can be measured in radians. Any angle can be measured in radians, then degree, then arc minute and arc seconds. So what is visual angle? Angle subtended by height of vertical edges of an object at nodal point of an eye. So that's the visual angle for a target object. So how it is measured? It can be measured in radians, degrees, arc minutes, and arc seconds. We have standardized charts to measure the visual acuity. ETDRS Snellen's chart, they measure the visual acuity in arc minutes, and obviously the tests for Verniers acuity, they measure it at arc second level. The test visual acuity at arc second level. Now what is radian? What's the relationship between the radian, degree, arc minute, and arc second? So I'll have to show you diagram here. 1 radian to, like, it's not very necessary, but if you're like me and if you're very curious to know so many things, and if you have time to know about these things, you will see how the radians can be converted to degree, and degree into arc minutes, and arc minutes to seconds. We have to see what is radian, and then degree we know. Radians, we'll see what is that. And 1 radian equals to 57.3 degree, around 55 degree, you can say, to remember it well. 155 can just remember. 1 radian is equal to 57.3 degree, and 1 degree is equal to 0.02 radians, that is 0.01745 radians. 1 degree is equal to 0.01745, that is around 0.02 radians. And 1 degree equals to 60 minutes, and 1 minute equals to 1 second. So 1 degree, 60 into 60, 3600 seconds. So I'll explain how the radians can be converted to degrees with the diagram, with my handwritten diagram here. See how the angle can be measured. This theta, suppose this is a part of a sphere, 360 degree sphere. So this is a part of a circumference of a circle, 360 degree circle. So this is, suppose this is an object, it's very small, so it can be compared with this part of a sphere. It can be compared as a part of a sphere here, circumference of a sphere. So this is the angle, this is the radius of this sphere or the circle, and then this is the base, this is subtended arc, and this is theta. So theta equals to the subtended arc upon radius. Actually, when it's a very small subtended arc, we can use this equation, arc upon radius. Otherwise we'll have to use tan inverse function. Tan inverse function equals to this opposite upon base here, like this. So but for very small angles, for very small angles or very small part of a circumference of a circle, we can use directly length upon length function, that is subtended arc upon this radius. So length upon length, okay, so it is equal to length upon length is radians. So theta is expressed in radians here. Now suppose this is the entire circle, okay, the circumference of a circle is 2 pi r, right? Pi is equal to 3.14, and for a full circle, if the subtended arc, we take it as a full circle, it becomes 2 pi r, and if we take the radius here in this equation, it's 2 pi r by r, so radius is gone. So what theta we get? 2 pi for 360 degree. For 360 degree, if theta is 360 degree, this subtended arc would be 2 pi r, circumference of an entire circle here, 2 pi r, and its radius, that is r. So theta is 360, we know, for entire circle. So we have got this value 2 pi, that is Now 360 degree equals to 2 pi, then 1 degree equals to 2 pi upon 360. So this is how we get the conversion. 1 degree equals to 0.02 radians, around 0.02 radians. The exact value is 0.01745. It's just to satisfy my curiosity. Otherwise, you're not committed to memorize all these things. Just remember angle, a part of a sphere, okay, can be measured. Angle can be measured in radians, degree, arc minutes, and arc second. So degrees, when it's a very small angle, then degree is not enough. We have to break it into arc minutes, then arc seconds. Like for microbes, we cannot use meter length or centimeter length because these are not visible. We will have to use micrometers, smaller units. So degree we cannot use for small angles, so we'll have to use arc minute and arc seconds. For human eye, we are testing the visual acuity, like threshold we are measuring, so we have to measure very small angles which cannot be measured lowest in the degree, because it's very low. The threshold for visual acuity is very low, so we use arc minute and arc second. Visual acuity is tested at these threshold level, arc minutes and arc second, depending upon the visual acuity type, that is minimal resolvable, minimal visible, and minimal discernible, or hyperacuity 1 year's acuity. So yeah. Now what is tan theta? Additional point I really like, because when it's a very big angle, we cannot use this subtended arc and radius exactly. If we want the exact value, we have to use the tan theta function, tan inverse function. Yeah, tan inverse function to calculate this theta. So it's equal to tan inverse opposite upon adjacent. Do you remember the log table we used to use in our 12th standard in junior college, second year junior college? Yeah, and we used to get this value. I remember that thing. I remember all these things. So it has practical value, tan inverse. And what is tan inverse? I really liked one of the YouTube videos. If you want to understand this, the practical application, and exactly know what's the tan theta, sin theta functions, and how practically these are used, there is a nice video on YouTube which I really liked. I'm going to share its link in the description box. If you're curious like me, you can go through it. Otherwise, we don't have to go so much in detail, but it's really good to know things this way if you want to just pass the exam, because we don't have time during our post-graduation. Then you can just forget these things. But if you are like me, if you are very much interested in the researches and for deeper understanding of the concepts, you can just go through these videos in the description box. The links I'm going to share. So yeah, done. Now we'll see what's the relationship of this visual angle with visual acuity. Now visual acuity, it's nothing but a threshold of this visual angle. We should know the minimal angle subtended by an object at the nodal point of eye, the smallest angle that we can see when it's minimally visible and minimally resolvable. What's that? I'll tell you. But first, I'll tell you the visual angle. More the visual angle, better is the visual acuity. Visual acuity means better is the vision. We can see object better. We see the object as a larger object if the visual angle subtended by an object at the nodal point of eye is larger. Then we see object as larger object. Suppose it's at a fixed distance, this and this. it's at a fixed distance, but I know that it is larger than this one. It is because it's subtending bigger angle at nodal point of eye, and it is subtending smaller angle at the nodal point of my eye, human eye. So that's the one of the significances of visual angle. Now the same object, this object, suppose now same object, it is at this distance, and it's moving farther away. Now it's far away from me, or a car that is nearer to us, and then it's going away or coming nearer. Then as it's going away, gradually the visual angle subtended by it at the nodal point of eye, it decreases. Okay, and that's why we see it as a smaller object as it passes away from us. So this has a practical value. We can see, we can judge the distance. We can also judge how fast the object is approaching, the car is approaching, and how fast it's going away. It's like it also forms a protective mechanism for us while driving. This sense is very important to judge the distance and judge our speed, and take a turn, judging the speed of other car, our car. So it's a very complex phenomenon to explain, but the practical significance of this visual angle is like this. It more the visual angle at a fixed distance, larger the object seems to be, and it also depends upon the distance. It also the visual angle depends upon the size of the object and distance of the same object from the eye. Yeah, so the size of the object and distance of an object from the eye, that these two factors decide the visual angle. Larger the angle, bigger the object. Larger the angle, closer the object. So remember these things. Let's move to the next point, and that is visual acuity testing types: minimum legible or minimum resolvable threshold, minimum visible threshold (MVT). MRT is minimal resolvable threshold. Then minimal separable threshold (MST), and vernier acuity or hyperacuity, which is a subtype of minimal discernible ability. So what is minimum? First I'll talk about minimum visible threshold. What is minimum visible threshold? Suppose there is an object, but we don't know what is that object at this distance. This is some size of object, it is at this distance, and I'm just seeing it as a point. I'm not seeing the details in that point. So that is minimum visible, and it tests the visual acuity function at around arc second level, around 1 arc second. So if an object subtends an angle between 1 to 10 arc seconds around, then it is seen as a dot. We cannot see what is inside that dot. Like, we cannot know the spatial details to recognize the dot as some letter or number or which letter, like that. Suppose the dot now it's suppose the object is making an angle around arc minutes. Minimum angle of resolvable angle is 1 arc minute. Suppose suppose let us take an example of letter E. A Snellen's chart, letter E. In that, the letter E subtends an angle of 5 minutes at certain distance. Okay, so we'll see 20 feet. So it is subtending an angle of 5 minutes. So we'll see that E object as E object, because each letter, each stroke, and the gaps in between the strokes, they subtend an angle of 1 arc minute, and that's why everything is resolvable, and the entire letter subtends an angle of 5 arc minutes. So we can see the entire letter as E. We can identify the letter because of we can see the details, the strokes and the spacing in between the strokes, like that. Suppose this letter E at a certain distance, suppose 20 feet, it's 5 arc minutes. Now it's getting smaller and smaller and smaller. It's very, very small. The letter E, it becomes very small. It is so small that you cannot see as a letter E. Just take an example of letter E, and it's going away from us, and at certain distance you won't see it as a letter E, you'll see it as a dot. Now that dot is the minimum visible threshold, and it is tested at level. It makes an angle in arc second, like 1 to 10 arc second. When it is 1 arc second, that is the minimal visible threshold for the human eye, when everything else is perfectly fine, no pathology in the media and no refractive errors. That time we can see, and no retinal pathology, no diseases of the human eye. That time that E is seen as a dot when it subtends an angle of 1 second, 1 arc second at the nodal point of eye. When it subtends at that distance of 5 arc minute, we can see the details now, that there is this line, there is this line, there is this line, there is this line, there is a gap between these two lines. That gap is around 1 arc minute, and that time we can see the letter E as E. But as it but at the same distance, its size is small, or it goes farther away, the visual angle subtended by it at nodal point of eye, it decreases to such a level. First it becomes blur, and we can see only at certain point, we see only a point. That E is seen as only a point, and that point subtends an angle of 1 second, and beyond that, even if it is there, we cannot see. For example, microbes, they are there, but we cannot see because they subtend angle less than 1 second at the nodal point of eye, and that's the minimal visible threshold. Okay, that's the difference between minimal visible threshold and minimum legible or minimum resolvable threshold. That's the difference between these two. Okay, that is the minimum size or minimum angle that can be appreciated in the visual field, and it also depends upon the contrast. We'll see visual acuity depends on which factors later on. Now, minimal separable threshold and minimal legible threshold and minimal legible resolvable threshold and minimal visible threshold. The difference I told you. I hope you got it. Letter E with the example of letter E, or you can see you can just take an example of any letter. You just at a fixed distance you reduce its size, or you just increase the distance till it becomes small, and you'll just see it as a dot. So that dot is minimal visible threshold, and at certain distance we won't be able to see it. So that dot, that dot is it subtends an angle of 1 second to 1 to 10 arc seconds. So minimal visible threshold, it is measured in arc seconds. That threshold lies between 1 to 10 arc second. And the minimal resolvable threshold, we need 1 arc minute at least. So what is minimal resolvable angle? Minimal angle of minimal angle of resolution. What is that? We'll see that thing. Or minimal resolvable angle. Now minimal separable threshold. What is that? Minimal separable threshold means to identify the gap in between the two objects. It's very important to see two objects are separated, 2 point images are separate images, or two dots are separate, or they are joined. If they are separated by a minimal distance that can be recognized by human eye, and that minimal distance, what angle it subtends at nodal point of eye, that minimal angle, that minimal distance that can be appreciated in between the 2 point objects, that is called as minimal separable threshold, MST, and it can be measured using the gratings and checkerboards, and it tests the acuity at 10 arc second level, less than 10 arc second level. And vernier acuity, it is the subtype of minimal separable threshold. It is also known as hyper acuity because it tests visual acuity at 2 to 3 arc second level. Now what is the application of the vernier acuity? It can be, Amsler's grid, applanation tonometry, keratometer, and lens meter. And what is Verniers acuity? It is ability of a person to identify a break in a line, segments in a line, break in a line, or misalignment in a straight line, whether the line above is to the right or to the left of lower line or upper line, whatever it is, vice versa. So that ability is Verniers acuity. The threshold for it, it's not like, yeah, we visual acuity testing is all about threshold, minimal threshold that can be appreciated by human eye. So Verniers acuity, it takes the acuity at 2 to 3 arcseconds. See, minimal resolvable angle, it is limited by the cone's dimensions, 1.5 micron. It subtends around 1 arc minute level, 30 seconds to 1 arc minute level, and cone spacing, that is 30 arc seconds. And to identify two objects at two different objects, there should be one cone that is unstimulated. So this spacing, like 30 seconds and 30 seconds, it makes 1 arc minute angle. And how to measure it, I'll just make another video for that when I talk about the factors affecting the visual acuity. After that, I'll make a video on diffraction, then point spread function, and minimal angle of resolution, because while talking about diffraction and point spread function, I can talk about the minimal angle of resolution also. So Verniers acuity, it takes the visual function at 2 to 3 arc seconds. Means this misalignment, the smallest misalignment, if it is like 2 to 3 arc second, makes an angle of 2 to 3 arc seconds at nodal point of the eye. Even at this minute level, we can recognize. Otherwise, a minimal resolvable, the form means what is that object. It also, for example, letter E. To see if you identify letter E as letter E, that is minimal resolvable, we can see the details in the E. Okay, the lines, the vertical lines, the horizontal lines, and the gap in between the lines. So that's minimal resolvable threshold, minimal resolvable ability. Then minimum visible threshold means just keep the letter E small. At a certain point, you will just see the dot, and that dot, if you just make it small, that letter E becomes dot, and then dot disappears at certain size, micron size. So that forms the minimal visible threshold. And minimal separable threshold, Verniers acuity. Now we have to take an example of the line. If suppose that letter E, it has this E line, upper line, and that has a break in that, and to identify that break, we can identify the break in the line at 2 to 3 arc second level. And how it's possible? It's possible because of enhancement of the contrast by the ganglionic cells at the ganglionic cell level and at the visual cortex level, because minimal angle of resolution to see the details is limited by the cone sizing, and hence it is 1 arc minute level. But still we can identify the breaks in a line, though we cannot identify the letter E, but we can just sometimes at certain image, we can just see the break in a line at that, at that small angle. It is because it's a function of the ganglionic cells and cortical processing that enhances the edge contrast. This processing enhances the edge contrast, and we can see the break. I hope you are getting, because it's very difficult to articulate. So Vernier acuity testing types: Amsler's grid lines, checkerboard, and its clinical applications, instruments, keratometer, okay, break in a straight line, then lens meter, and Amsler's grid, wavy lines, breaks in the lines, segmented lines, and applanation tonometer. Those edge lines we have to match. So it's all the Vernier's acuity applications in the instruments. So that was all about the visual acuity testing times: minimal resolvable threshold, minimal visible threshold, minimal separable threshold, and Verniers acuity, hyper acuity. Now coming to factors affecting the visual acuity, there are three main factors: target related factors, visual field factors, what's happening in the visual field, then what's happening in the human eye, optical factors, eye as a lens system, and physiological factors like at the retina level, at the brain level, so cortical processing. These three main factors, they affect the visual acuity. Now what are they in detail? Now target related factors, visual field factors. Now what's happening in the visual field? Size of a target. If the size of the target is more, visual angle will be more, and hence we can see it better, the details will be better. Then distance of an object from the human eye, from the nodal point of an eye. If it is more, then angle will be less, smaller, and hence the visual acuity will be less for distant objects. The clarity will be less. Then contrast of an object. It is nothing but the lightness or darkness of an object with surrounding or the background. For example, if it is a white background and it is a dark line here, a dark letter, we can see it better. If it is replaced with a gray letter, we cannot see it nicely, or white against white, we cannot see it nicely. The visual acuity will be reduced if the contrast is less. Contrast is more means it is, if it is more lighter against the darkest background, or more or it is darker with respect to the lighter background. More the difference between lightness and darkness between the object and its surrounding, then better is the visual acuity because the contrast is better. Then light conditions. In light conditions, mesopic light conditions, at moderate level of light, its visual acuity is better, it remains constant. And if it is dark, then our visual acuity is less. It depends upon the wavelength of light also. How it is dependent on the wavelength of light, it is, we'll have to see that Rayleigh criterion. More the wavelength of the light, we'll have to see what is airy disk, and then the central part of the airy disk, and the radius of that central bright maximum to the dark minimum. That distance we'll have to see, because the wavelength of the light affects that distance. If it is more, that radius will be more from the center of the airy disk to the dark minimum of the other object. So if that is more, then diffraction is more. It happens because of the phenomenon of diffraction, that is bending of the light, wave nature of light. So more the wavelength of the light, there is decrease in the visual acuity, and it is according to the Rayleigh criterion. We'll see it later. You just remember, longer the wavelength of the light, decrease in the visual acuity. It is according to the Rayleigh criterion. Now, movement of the target is steady or moving. If it is moving, then we cannot see it clearly, we cannot see the details in that object if the target is moving. So that causes decrease in the movement of a target, causes decrease in the visual acuity. Then exposure time of a target to the human eye. Actually, it doesn't have much effect unless it is for a shorter duration. At certain limit, beyond certain limit, if it is very short, then we cannot see the details of an object like this. I cannot see the detail because the exposure time is less. But if you just keep it for 1 second and then for a long period of time, then it will be and there is no effect of that related to the visual acuity. But if it is for a shorter duration of a time beyond certain limit, then it causes decrease in the visual acuity, exposure time of a target to the eye. And it also depends upon where it's falling. If it is falling on the extrafoveal point on the retina, then exposure time is going to cause decrease in the visual acuity because of the Troxler's phenomenon. What is Troxler's phenomenon? I have already explained in one of my videos. You can see that thing, or there are so many other videos, nice videos on YouTube. You can see what is Troxler's phenomenon. Troxler's phenomenon means when we are focused on one object for a long duration of a time, the peripheral objects in the visual field, they start disappearing. But it doesn't happen in case of human eye because of the microseconds. Microseconds means micro movements of the eyes, which a person looking at our eye cannot see your eyes moving, but there are microseconds which are happening constantly to avoid this phenomenon, that is Troxler's phenomenon. Otherwise, if I would be focusing on one object, or if we would be focusing on one object, then the periphery would disappear. But it doesn't happen because that disappearance is Troxler's phenomenon, and it is avoided by microseconds of human eye. Now, another factor is crowding. How closely the targets are placed with each other. Actually, for central vision is not affected by this crowding phenomenon, but in case of amblyopia or extrafoveal fixations, this crowding phenomenon plays an important. For example, if a person is shown a single letter at the same testing line, the person can identify it if the person is having amblyopia or having extrafoveal fixation. Then the person can see that same single letter. But if you just place the letters at the same testing line, the person has a difficulty in identifying the same letter because there are other letters also in the line, and that angle is around 4 to 5 arc minutes. If it is less, then it causes decrease in the visual acuity. That's the crowding. How close the interaction of objects with each other, or distance between the objects with each other, even though this obtained angle that is more than resolvable angle, but it is affected in case of amblyopia and extrafoveal fixation cases. So that was about the factors related to the objects in the visual field. Now, the factors which affect the visual acuity inside the human eye when the eye is functioning as lens system. Now, first thing is refractive errors, cornea, starting from cornea lens. Refractive errors, they cause decrease in the visual acuity, obviously, and there is some proportion in case of there are spherical refractive errors. There are different types of refractive errors, cylindrical, spherical, but spherical has some proportion with respect to loss of visual acuity. Now, spherical refraction around 0.5 diopter, it causes decrease in the visual acuity by 1 line. Then coming inside, media opacities, starting from cornea, media opacities, refractive errors. Then size of the pupil. How size of the pupil affects the visual acuity? Actually, for optimal visual acuity, the size of pupil should be between 2 to 6 millimeter, because if the size of the pupil increases, the edges of the corneal lens are those rays from the edges of the cornea and also incident upon the lens. on the retinal image. These will be included if the size of the pupil is more, and that increases the spherical aberration. What is spherical aberration? Spherical aberration is seen in case of the spherical lenses. Now if it is a sphere, it's the peripheral rays are bent more, that is towards the lens, than the central rays. Central rays will be focused here and the peripheral rays will be focused here, so they are not focused at a single point, and then we don't get a point image, we will get a circle image like this. So spread out image, not a clear image of an object. So that's the spherical aberration. It is seen in case spherical because it is seen in case of the spherical lens, and we get a blur, spread out image of an object. So if the size of the pupil it increases, what it causes, if the size of the pupil increases, it causes the spherical, it increases the spherical aberration. So if the size of the pupil is less, the diffraction gets worsened. If it is more, the diffraction is better, and that's why we should get the pupil size in between to reduce the spherical aberration, to find the balance between the spherical aberration and diffraction. So it is optimum size is 2 to 6 millimeter. How the diffraction affects the minimal angle of resolution, that we'll see using the Rayleigh criterion later on, when I'll be talking about the diffraction phenomenon and Rayleigh criterion. What happens because of the diffraction, we get an image, a pattern of an image that is in the form of airy disk, that is central bright spot, central bright circular spot that is surrounded by alternate dark and light rings. And this lightness or brightness, it decreases in the periphery. So that's the diffraction. And to see two objects as two different objects, or to see the details in an object, for example strokes in letter E, or the gaps in between the two lines in the letter E, to see that that is the resolution, that distance, that minimum distance, it defines that resolving ability, and that is dependent on the this airy disk pattern that we get because of the diffraction, because of the wave nature of the light, and it is defined by the Rayleigh criterion. If the pupil aperture, the diameter of the pupil aperture is less, the distance between the center of the airy disk with the first dark minimum of the other object, and minimal angle of resolution, it depends upon this distance. If the visual acuity is better, it's because this minimal angle of resolution is less, and it depends upon this distance between the center of airy disk with the first dark minimum, or you can say the radius of airy disk. It becomes if it is smaller, the minimal angle of resolution is smaller, and better the visual acuity, and it depends upon the wavelength of the light and pupillary aperture. And if the pupillary aperture is less, then the diffraction is worsened, and this radius distance, it is, this radius is more, and minimal angle of resolution will be more, and that's why the visual acuity is less in such situations. So that's why the size of the pupil, it affects the visual acuity because of the diffraction and spherical aberrations. An optimum size to balance these two aberrations is 2 to 6 millimeter for optimum visual acuity. And wavelength of the light, the red light has longer wavelength, so it will be focused behind the retina, then blue in front of the retina, like that. So it gives rise to not a point image but spread out image. So this is called as aberration, chromatic aberration. It leads to image degradation and it affects the visual acuity. It decreases the visual acuity, chromatic aberrations. So that was all about the optical factors. Now physiological factors which are related to the retina and cortical processing. Now physiological factors, foveal cone dimensions, foveal cone density, exactly not dimensions, because anyways dimension also, because the density depends upon the dimension also. The minimal angle resolution depends upon the dimension and density also. Foveal cone density at the center of the fovea, in the central part of the retina, at the foveola, these cones are densely packed, so the distance between the two cones, it is minimum. Less the distance, better the visual acuity, because there should be at least one cone unstimulated in between the two. If there are two objects, there should be at least one cone unstimulated in between the two, then the two objects can be recognized as two different objects, and the spacing is 30 seconds. So 30 seconds becomes 1 minute. So minimal angle of resolution, because of the cone spacing is 1 minute, and if it is, and this cone spacing is, or cone density is less in the periphery, and that's why visual acuity in the periphery is less. That is one of the reasons, because of the foveal cone density. Then second is visual field receptivity. What is visual field receptivity? It is the number of the cones or the rod photoreceptors falling onto the ganglionic cell, a single ganglionic cell. So in the central part, the ratio is 1:1 for cone to ganglionic cell. So one cone sends a signal to one ganglionic cell. It's going to excite one ganglionic cell and one bipolar cell. That's the ratio in the central part of the at the fovea. So that's why the visual acuity is better. So visual acuity is better when this, and that is called as it's a part of the visual receptive field. What is visual receptive field? It is number of the photoreceptors converging onto the single ganglionic cell. So in the central part, what happens? This receptive field is smaller. Smaller means less photoreceptors falling onto the per ganglionic cells. Less photoreceptors per ganglionic cell. It's 1:1 ratio. One cone to one ganglionic cells, and that's the visual acuity is better. But the sensitivity of this field to the light is less. So that was about this cone confluence onto the ganglionic cells, or receptive field, effect of receptive field on the visual acuity and light sensitivity. If it is large receptive field, then that is more photoreceptors converging onto the ganglionic cell. So effect of visual receptive field on the visual acuity and sensitivity to light. If it is large receptive field, means more photoreceptors falling onto less ganglionic cells, or more photoreceptors per ganglionic cell. That happens in the periphery. More rods per 1000 rods per ganglionic cell. That happens in the periphery. So peripheral retina is very sensitive to light. For example, dark adaptation. So it's very sensitive to light, and but its visual acuity is less because of the large receptive field. But at the center, this ratio is 1:1. That is one cone cell per ganglionic cell almost. So that's going to increase the visual acuity, spatial details, more sensitive. This small receptive field means less photoreceptors per ganglionic cell. At foveola, it is 1:1 cone as to bipolar cell to ganglionic cell, it is 1:1, and hence it's a small receptive field, better visual acuity, but less sensitive to light. That's the central portion is less sensitive to light because of the small receptive field, and periphery, and also cones are predominant in this area, and peripheral retina, large receptive field, and also because of the dark adaptation, more sensitive to light, and less sensitive to spatial details. That is, resolving ability is less, that is visual acuity is less of the peripheral retina. Now effect of retinal illumination. Obviously, visual acuity is less in scotopic vision and more for photopic vision in light conditions. Retinal eccentricity. If it is eccentric fixation, obviously because of I say it is because of the receptive field at the periphery. It's large receptive field, so less visual acuity but more sensitive to light. So that's retinal eccentricity. And also foveal dimensions. Foveal density is less in the eccentric area, and that's why the minimal angle of resolution in the eccentric area or extrafoveal portion is more, and hence visual acuity is less. Now, what is point spread function? Point spread function, I'll be talking about it in the other video, a separate video for diffraction, separate video for point spread function. Now, point spread function means it's the sharpness of an image onto the retina. Suppose point spread functions means what? It is a point source or point object, light rays coming from that thing and falling onto the retina and forming, it should form a point image, like sharp image. Sharp line should form a sharp line image. Okay, sharp object should produce sharp lined image onto the retina, but it doesn't happen. It is spread out. It is spread out because of various phenomena or causes of the aberrations, like spherical aberrations, comma aberrations, and then diffraction. So the image is not sharp. The point will not seen as a point, but spread out image, because the image is spread out because of this diffraction pattern. I'll just be talking about it in the later video. So point spread function, if it is more spread out image on the retina, it's going to decrease the visual acuity. Eye movements. Microseconds are important to eliminate this Troxler's phenomenon. I have already discussed what is Troxler's phenomenon, so I'm not going to repeat that thing. So eye movements are necessary to eliminate this Troxler's phenomenon. And if there are eye movements, very gross eye movements, fast gross eye movements, visual acuity decreases. For example, in nystagmus, eye saccades, we can say fast eye saccades going to decrease the visual acuity. Now, seventh point is exposure time. Exposure time of an image falling onto the retina. If it is more, actually it doesn't have any effect unless it is a very brief period of time, for a very short duration of time, then the details won't be clear. But beyond certain limit, it doesn't have effect on the visual acuity. Shorter the duration, beyond certain limit, it's going to decrease the visual acuity, but beyond certain limit, it doesn't have any effect on the visual acuity. So exposure time. And if it is falling on the extrafoveal point of focal point, if it is falling for the human eye, then because of the Troxler's phenomenon, it's the object is going to disappear, but it doesn't happen because of the microseconds. That's one of the if it is longer exposure time, it's going to disappear extrafoveal image, like our brain will ignore those images and we won't be able to see those images falling on the extrafoveal points if they remain, if we constantly stare at one object. And even these peripheral images, peripheral objects, their images on the peripheral retina, extrafoveal points, will start, our brain will start ignoring them, and we won't be able to see them after if we just keep it staring at a certain object for a long time. But it doesn't happen because our eyes move, that is microsecond. So microseconds eliminate the Troxler's phenomenon. That disappearance of peripheral objects or peripheral image, it is Troxler's phenomenon, and that is overcome with the microseconds. Now, eighth point is binocular vision. See, binocular vision, it lessens the optical blur and improves the visual acuity. For example, one eye is having 6:12 vision, another eye is having 6:9 vision. Both eyes, with both eyes open, the person will have around 6:6 parts or 6:6 vision. So this binocular vision, it lessens the optical blur. It betters the visual acuity. Accommodation is important. Accommodation helps in, visual acuity, near visual acuity especially. Now age, before 6 months of age, this retina and all the cortical elements are not very mature, around 6 months, 1 year, so visual acuity is not that great. But after in youthful time, in healthy individuals, it's better. But as we age, because of media opacities like cataract and other certain conditions, age related conditions, our visual acuity, it falls, and because of the accommodation, also less accommodative power. So that was all about the factors affecting visual acuity. Next video will be on the diffraction, then point spread function. One more thing I forgot to mention that affects the visual acuity, and it has a practical application. That's why it's very important to mention. Pinhole effect. Pinhole effect, it works like reducing the size of pupil. It has equivalent effect like reduction in the size of the pupil, reducing pupil diameter. So what pinhole effect does is that it reduces the spherical aberration. It cuts off the divergent rays, or the rays that will hit the edge of the cornea and edge of the lens, reducing the spherical aberration, so improving the visual acuity. Second thing, what it does, it increases the depth of field. It increases the depth of focus. So depth of field is what? It is like person's ability, or a system's ability, or human visual ability to see the object clearly, even if the image is off focus a little bit, before the focal point or behind the focal point. For certain distance, if the image falls, we can see it clearly. So that is called as depth of field. That distance ahead and behind is called as depth of field. More the depth of field, longer the depth of field or depth of focus, it's better tolerance to the refractive errors. So how the pinhole effect, it improves the visual acuity. First, by reducing the spherical aberration, by cutting off the rays hitting the corneal edge and lens edge, first thing. And second is it increases the depth of field. Depth of field becomes longer with decrease in the size of the pupil. But another effect, it is that according to the Gaussian beam profile, bigger the size of pupil, it causes increase in the size of circle of least confusion, which increases the minimal angle of resolution, and that subsequently reduces the visual acuity. So that is not pinhole effect, it is the effect of increase in the size of the pupil. So these things I forgot to mention when I was talking about effect of certain factors on visual acuity. So pinhole effect, this is very important, how it works: decreasing the spherical aberration, cutting off rays hitting the corneal edge and the lens edge. And second thing, by improving or increasing the depth of focus or depth of field. What is that? It is the deviation from the focal point for which ahead and below person can see clearly, a visual system can see clearly when it falls off the focal point. So longer the depth of focus or depth of field, better the visual acuity, better the tolerance for the refractive errors. And that's why with pinhole, if the vision is improving, it is probably most probably because of the refractive errors, and it has a practical significance, and that's why it's very important to mention pinhole effect when we are talking about effect of certain factors on the visual acuity. So this was all about the factors affecting the visual acuity.